So in terms of kind of recognizing that you might have ADHD, what are the general signs and symptoms that you might see in your child that would raise a question mark? And if you're an adult, how does that manifest different? So let's talk about children first. So if you had a child, what are the signs and symptoms? You said difficulty concentrating on tasks and potentially also hyperactivity.
Yeah, so it would be either difficulty concentrating, and that would be in more than one domain. So it would be, not just necessarily one subject in school, but if it's in school in general. Although if a child's particularly interested in a topic, there's something called hyperfocus, where it's one of the superpowers of ADHD that a child can actually go into a state of hyperfocus where they're interested in a topic to the point where they can stay on that for potentially hours on end. Sometimes it's not so helpful when the hyperfocus is on gaming, for example, but it can be really, really helpful if it's a topic that they're particularly interested in. But yeah, so you'll find generally that focus is difficult, paying attention is difficult, and so they're easily distractible, can jump from some, kind of wanting to do one thing to wanting to do something else very easily. And then the hyperactivity and impulsivity would be constantly on the move, wanting to do something. And the impulsivity would be not really having the inhibition to weigh up whether they should or shouldn't do something. Yeah. Quick neurology kind of lesson here is the brain has the basal ganglia and the prefrontal cortex are the two main areas, with the cerebellum as well, that are involved in ADHD as far as we understand. And they're involved in things like emotional regulation, impulse control, executive function, and focus and attention. Now, the brain develops, as we mentioned, until the age of 25 to 30. So a lot of adults will grow out of certain elements, like maybe the hyperactivity or impulsivity, but the inattention might remain. So they might have been a child that was impulsive and hyperactive, and couldn't focus and couldn't concentrate. But as an adult, less so on the hyperactivity and impulsivity, but they might still have that lack of ability to focus on tasks. And that means that, they procrastinate, don't get things started. When a task has a number of elements to it, unless it's broken down into bite-sized chunks, it just seems overwhelming and is put off indefinitely.